More headlines now. We've learned Rhode Island has secured a $150 million line of credit to help with its cash flow. Warwick and Middletown are following the state's lead in closing all of their beaches. And Governor Gina Raimondo is also promising new help for struggling small businesses.
Eyewitness News reporter Kim Kalunian joins us now live from the State House with an update. Kim?
Well, Mike and Shannon, it's now been 32 days since Rhode Island's first reported case of coronavirus. And today the governor spent some time outlining how the state has responded and also how much has changed since March 1st. Governor Gina Raimondo says teams of people are focused daily on completing essential coronavirus-related tasks, including acquiring hard-to-find personal protective equipment.
Today, right now, we have on the way to Rhode Island over 5 million N95 masks, over 3 million surgical masks, hundreds of thousands of gloves, hundreds of thousands of gowns.
The state is also working with researchers across the country and the CDC to assess what's next, assembling a model that might be ready by next week.
It will be a steep increase. I'm going to be reporting numbers that it's not going to make anyone comfortable. Exactly when the surge happens, what the peak looks like, when the peak comes, I don't know right now. We have estimates, but we are working it, and we're going to refine it every day.
Raimondo says by Thursday, the state will have the capacity to test 1,000 people a day. And while the number of cases and deaths continues to climb, the Department of Health is not yet ready to provide a hard number of those who have made full recoveries.
The vast majority of people with COVID-19 do get better, so 85 to 90% recover, rather uneventfully. It's a mild illness. It's so mild, quite frankly, that some people don't even know they have it.
Medical Director Dr. James McDonald says 33 COVID-19 patients have been discharged from the hospital since the outbreak began.
We are keeping track of it, though, but we just haven't been talking about it. We're focusing on what we think right now is most important, is identifying the cases, doing the contact tracing, and then getting the appropriate people into quarantine.
And today the governor also offering some assistance for some of the groups that have been hardest hit at this time, including small businesses. Today she announced a new program that will allow them to apply for short-term bridge loans. And also she's reaching out to those folks who are stuck inside their homes, whether due to quarantine or other reasons. If you need food delivered to you, you can now go to ridelivers.com or call 211 for assistance. We do have information on both of these programs available on our website, WPRI.com. Live at the State House, I'm Kim Kalunian, Eyewitness News. Hi Mike, hi Shannon. As the cases and number of deaths has continued to rise, every day we've been getting the same question from a lot of viewers at home. How many people have recovered? Well, we've asked this question previously and the Department of Health has told us many Rhode Islanders have recovered. Today, the medical director from the Department of Health says 33 people have been discharged from the hospital since the outbreak began. But today I asked for a specific number of recoveries or an estimate of how many active cases there are. Here's the response we received.
I get why you're curious. So we do have the 566 cases that we know about, but we actually know that there's many more people, only some more people who've had COVID-19 who haven't been tested, and that's not expected. In other words, we know some people have a mild course of it and get better. We have every reason to believe that well over 90% are recovering quite quickly and doing quite well with it. So I just think that's a context setter for this. Just keep in mind, too, as far as context goes, we are on day 32 since our first patient, and it's really only the 13th week since this world has even known about this disease. So we're really focusing on what we believe to be the most important thing, which is identifying the cases. And that's why I'm excited about the testing that's going on. We've really done a lot to ramp up the testing, and you're going to see more testing starting tomorrow. And as we get more testing done, we are going to identify more cases. And I think that's going to be very helpful as we get more people identified, more people quarantined, and I think it'll help us get ahead of this.
And on the topic of testing, the governor today said by tomorrow the state will have reached its ability to test 1,000 people per day. She also said perhaps by next week the state will be ready to unveil its model that it's created to try and determine when the number of cases will peak here in Rhode Island. Reporting live at the State House, I'm Kim Kalunian, Eyewitness News.